Hi guys, Brent from Anterior. Just want to go over a couple basics that we have for you here. This is our occlusal staining guide and anterior layering guide. If you don't have one of these things, just contact us so we can get this for you. We send it out with all new doctor packages, but if you've been with us for a while and yours is getting worn out, we can get you a new one here. But you can see the occlusal staining guide for the posteriors. You can reference what you like as far as occlusal stain. OS1 meaning pretty much no occlusal stain, all the way up to OS7 with heavy occlusal stains. So it's kind of nice to have these things in your operatory, and we have a bunch of these things. And just on the RX, just mark what you like. The other thing too, on the anterior layering guide, we've got different types of look and incisal translucent looks, especially if it's going to be like a smile design case. If it's a smile design case here, you want to make sure you have it nice and natural because it's all layered in. But you have to be a little bit careful on this stuff because if you have too much of it there, we may think that AL4 is cool. The patient may not think it's cool. So you want to be very, very careful with that. As a rule, we actually default on all of our cases to like an AL2 incisal translucency here, which is, again, is kind of like a minimum to a moderate type of look. Just enough that you can kind of see some of the mamelon developments in there, but not too translucent as far as over here, where the people might get a little bit concerned that looks too much like a gray line and such. And again, for the occlusal staining guide, we actually always default to no occlusal stain unless you ask for it there. It might be specific to a case or specific to a preference there. But just again, a couple tools to kind of help you communicate with us to see what kind of characterizations you want to have with your cases. Okay? All right, guys. Thanks a lot now.